Bismillahirrahmanirrahim. Assalamualaikum and very good day to all. I'm Ibrahim bin Salleh and today I'm glad to be here to share my paper publication entitled Is Socio-Demographic Status, Body Mass Index and Consumption of Food Away from Home Associated with High Sodium Intake Among Adults in Malaysia, finding from the Malaysian Community Salt Survey. This paper was published in the Journal of Health, Population and Nutrition 2021. So why eating meal away from home is important? It's because eating meal away from home was associated with a relatively higher intake of energy, sodium and fat, and lower intake of micronutrients. As the frequency of eating meals away from home have increased, the risk of non-communicable disease such as hypertension will also increase. So modern lifestyle has contributed to an increasingly prevalent habit of eating out in Malaysia, especially in the urban areas. It is well known that one of the preventable risk factors for high blood pressure is excessive sodium intake from the diet. So based on the recommendation from the WHO, sodium intake should be less than 2000 mg or 2 g per day or equal to 1 teaspoon or 5 g of salt, and based on MRI for Malaysian adults is less than 2300 mg per day. So for the methodology, now we move to the methodology part. This MyCoSS study was a cross-sectional study nationally representative household involving 1,440 adults aged 80 years and above. A stratified cluster sampling method was applied to ensure national representative by strata. It covers the urban and rural residents in the non-nutritional living quarters. Data collection was done from October 2017 until March 2018. For the socio-demographic information such as gender, ethnicity, marital status, locality, education levels, employment status, household income, and BMI was captured in this study. Body mass index was calculated and categorized based on the WHO 1998 classification, while meal pattern was assessed through interviews. Meal pattern refers to the commonly practiced meal by the respondent. Data was collected on the meal intake including breakfast, lunch, and dinner in a day and some of those meals at home or away from home. Having breakfast, lunch, and dinner away from home were then grouped into the category of having 3 meals away from home. Dietary sodium intake was assessed using a food frequency questionnaire FFQ. Now we look at the result section. For the first 3 variables, table 1 shows that by age group, respondent aged less than 30 years old and followed by age 30 and less than 40 years old consume higher sodium intake, and by gender, male consume higher sodium intake, and by ethnicity, Bermuda, Sabah, Chinese, and Malay had higher mean sodium intake. Following to the other variable, for the marital status, neighbor married have higher mean sodium intake, and respondents from urban area, tertiary and secondary education working at private, public, and self-employment had also income more than 2,000 ringgit Malaysia had higher mean sodium intake. Another variable such as BMI, an underweight respondent show higher mean sodium intake, and respondents having breakfast, lunch, and dinner away from home consume the higher intake of sodium. And those respondents having 3 meals away from home showed the higher mean sodium intake. Further analysis in table 2, using a logistic regression, we can see that younger age group were more likely to have 3 times higher dietary sodium intake, while age 30 to less than 40 years old 2.75 times, and 40 to less than 50 years old 1.6 times compared to the adults aged 50 years and above. For the ethnicity, Indian ethnicity consumed significantly lower dietary sodium compared to the Malay ethnicity, had a 54% lower tendency to consume high sodium intake. In terms of body mass index, overweight and obese participants consume significantly lower dietary sodium. In the multivariate analysis, obese participants had 40% lower tendency to overconsume sodium in a day compared to participants with normal BMI. And having away from home meals, regardless of frequency per day, was not associated with high dietary sodium intake. For the discussion, our study found that 52% of the Malaysian adults exceed the dietary sodium recommendation. This problem is alarming as high dietary sodium intake is associated with various non-communicable diseases. Similarly, the National Nutrition Survey from Singapore also revealed that more than 60% of adults consume salt higher than the recommended amount. Our study also found that the younger age, less than 30 years old, were 3 times more likely to consume sodium compared to adults aged 50 years and above. Other than that, by ethnicity, Indian ethnicity in this study consumed significantly lower sodium compared to Malays. A systematic review of 8 observational studies in Malaysia showed that Malay adolescents had a lower diet quality. There's a high chance that these bad dietary practices among adolescents could have brought into adulthood. And lastly, away-from-home meals are popular in Malaysia and other countries. The present study found that 64% of the participants had at least one away-from-home meal per day, but we could not find any association between away-from-home meal and dietary sodium intake, which was exciting finding in our study. It showed that Malaysians use excessive salt during food preparation, even for meals cooked at home. And for the conclusion, more than 50% of Malaysian adults were found to exceed the recommended dietary sodium intake and also consume at least one away-from-home meal. However, having an away-from-home meal is not significantly associated with high sodium intake in this study. Therefore, sodium reduction strategies should focus on all individuals, including those who eat out frequently and individuals who prepare food at home. Moreover, education on dietary sodium reduction should be emphasized among different ethnicities and people of a younger age to prevent the early onset of high blood pressure and other related non-communicable diseases. With that, thank you very much for the listening.